If you are one of the millions of people currently taking medication to manage your blood pressure, the information you are about to hear has the potential to fundamentally transform the way you approach your daily treatment. Because there is a critical piece of the puzzle that the vast majority of patients never fully grasp. It is not solely about which specific pill your doctor prescribes. The question of when you take that pill is equally, if not more, critical. A simple, seemingly insignificant mistake in timing, something that countless individuals do on autopilot every single morning or night, could be quietly and systematically undermining the efficacy of your entire treatment plan. Even worse, it could be leaving your heart, blood vessels, and kidneys dangerously unprotected during the most vulnerable hours of the day, putting you at unnecessary risk. In fact, I have witnessed this exact scenario play out time and time again, week after week, in patients who were convinced they were doing absolutely everything correctly. They were taking their prescribed medications faithfully, yet they continued to struggle with erratic and unstable blood pressure readings, debilitating episodes of dizziness, or unexpected and frightening complications that seemed to come out of nowhere. Today, I am going to provide a comprehensive breakdown of the most hazardous timing errors associated with blood pressure medications. These are the mistakes that, unfortunately, most doctors simply do not have the time to fully explain in a rushed 10 or 15-minute office visit, but which can absolutely make a profound and tangible difference in your long-term health outcomes and overall quality of life. Please stay with me until the very end, because one of the timing errors I am about to reveal is so incredibly common that most people are completely unaware they are even committing it, until it potentially escalates into a very serious and avoidable medical problem. If you habitually take your blood pressure medication alongside your morning cup of coffee, you need to pause what you are doing right now and pay very close attention to this video. If you routinely take your diuretic, also known as a water pill, anytime after 2 o'clock in the afternoon, the same urgent warning applies directly to you. And if you have ever, under any circumstances, decided to double up on your dosage after realizing you missed one, I need to have a very important and direct conversation with you. What I am about to explain in detail is information that your pharmacist absolutely should have provided to you the very first day you filled that prescription at the counter. This is the definitive guide to the most perilous timing mistakes in blood pressure medication management. Every single day, countless patients across the country take their blood pressure medication. And yet, there is one particular timing mistake that I find myself correcting on a near-weekly basis in my clinical practice. It is a mistake that most doctors never properly address during those incredibly brief, high-pressure appointment slots. If you are taking your blood pressure medication either in the morning or at night without a solid understanding of the specific timing rules that apply to your individual situation, you could inadvertently be cutting its effectiveness in half. Or, even more alarmingly, you could be creating a dangerous window of vulnerability where your heart and kidneys are left with inadequate protection, especially during the early morning surge when cardiovascular events are most common. What I am sharing with you right now is the exact same guidance I personally provide to my own patients after the prescription has already been written and handed to them. It is the crucial, life-saving conversation that so rarely gets the attention it deserves inside the four walls of a typical exam room. Please remain with me, because timing mistake number 3 is the one that consistently shocks and surprises people the most, often because it involves something we all do every day without a second thought. I'm Dr. Mandell. I established this channel because I firmly believe that the vital, protective information we use to safeguard lives within the confines of my clinic should not be locked away behind closed doors. Blood pressure medication is, without question, one of the most frequently prescribed classes of drugs in the entire United States. The vast majority of patients are given clear instructions on what to take, but they are left in the dark about when to take it, what they should or should not consume alongside it, and what specific things they need to actively avoid. This missing, often overlooked information is quietly and persistently having a negative impact on people's health to a far greater degree than most of them realize. Today, I am going to systematically walk you through the 5 most hazardous timing mistakes associated with blood pressure medication. These are errors that can significantly elevate your cardiovascular risk, drastically reduce the intended effectiveness of your drugs, and, in the worst-case scenarios, even trigger serious and life-threatening complications. And of course, I will also provide you with a clear, actionable list of exactly what you should be asking your doctor or pharmacist before you take your next dose. If this is the kind of clear, straightforward, and honest medical information that you value and want to see more of, please consider subscribing to this channel. I publish one deep dive, in-depth video every single week, focusing specifically on this type of practical, real-world health guidance that you can actually use in your daily life. Let's begin our discussion with one of the most widely prescribed groups of medications in this category: ACE inhibitors and ARBs. This includes common drugs like lisinopril, ramipril, losartan, and valsartan, which are prescribed daily to tens of millions of people. For decades, the standard default instruction for these medications was incredibly simple and uniform. Take it once daily, first thing in the morning. However, that conventional wisdom was largely based on historical precedent and convenience, not necessarily on a robust foundation of strong, evidence-based science. Recent and emerging research has uncovered something truly fascinating and potentially practice-changing. Patients who choose to take their blood pressure medication at bedtime may actually experience significantly better cardiovascular outcomes compared to those who stick with the traditional morning routine. We are talking about a demonstrably lower risk of experiencing a heart attack, a lower risk of suffering a stroke, and, in some compelling studies, even a lower rate of cardiovascular mortality overall. So, why does this biological phenomenon occur? The answer lies in the natural 24-hour circadian rhythm of our blood pressure. In a healthy pattern, blood pressure naturally dips to its lowest point during the deep stages of sleep, and then it surges sharply upon waking in the early morning hours. This is a well-documented physiological event known as the morning surge. Critically, that early morning surge is precisely the time of day when heart attacks and strokes are most statistically likely to occur. A medication that is taken right before bed is still at its peak active concentration in the bloodstream during that extremely vulnerable early morning window. Conversely, a medication that was taken the previous morning may have already seen its effectiveness significantly wane or wear off by that same crucial period. This is not some minor, insignificant detail. It can have clinically meaningful and measurable effects on patient outcomes. However, I must be completely transparent and honest with you. The scientific evidence is still evolving and is not yet universally settled. Some studies clearly demonstrate the benefits of bedtime dosing, while others have found little to no difference at all. The truly correct timing for your specific situation depends entirely on the particular medication you are taking and your individual, unique blood pressure pattern throughout the day. The practical advice I consistently offer my patients is simple and direct. I tell them to ask their prescribing physician a very specific question. Should I be taking this medication at bedtime instead of in the morning? That one single question, asked aloud, can be the catalyst that opens the door to a much more personalized, tailored approach to your overall hypertension treatment. If your doctor can provide a clear, well-reasoned explanation for why morning or bedtime is better for your specific case, that is the ideal outcome. But if they pause, consider it, and admit they have never really thought about it before, that also tells you something incredibly important about the level of nuance in your current care plan. Now let's pivot to something that never fails to astonish people every single time I bring it up in my clinic. I have had countless patients come through my doors who have been doing this particular thing daily for years, completely oblivious to the fact that it was a significant problem. I am talking about the interaction between blood pressure medications and grapefruit. Grapefruit and grapefruit juice contain specific compounds known as furanocoumarins. These naturally occurring chemicals work by blocking a critical enzyme in your digestive system, an enzyme called CYP3A4. This enzyme is essential because it is responsible for the normal breakdown and metabolism of many blood pressure medications, especially a class known as calcium channel blockers. This includes commonly prescribed drugs such as felodipine, nifedipine, and amlodipine. When this crucial enzyme is effectively blocked by grapefruit consumption, your body is unable to process the medication at its normal, healthy rate. The direct consequence of this is that the levels of the drug in your bloodstream can rise dramatically, sometimes reaching dangerously high and toxic concentrations. This can rapidly lead to an excessive and dangerous drop in your blood pressure, resulting in dizziness, fainting spells, and, in some of the more severe cases, even dangerous heart rhythm disturbances or arrhythmias. What makes this interaction even more critical and problematic is the surprisingly long duration of its effect. Grapefruit has the capacity to interfere with this enzyme for a staggering 24 to 72 hours after you consume it. This means it is not just a matter of avoiding it at the exact moment you take your pill. A single glass of grapefruit juice consumed at night can still significantly interfere with your medication's metabolism the very next day. If you are currently taking any type of calcium channel blocker, it is absolutely imperative that you ask your pharmacist a direct and unambiguous question. Is grapefruit a serious concern with this specific medication I am taking? Please, do not ever assume it is safe simply because you have not experienced an issue before. Always confirm this interaction directly with a qualified healthcare professional. We now move on to timing mistake number 3, and this is, without a doubt, the one that consistently surprises people the most. It is surprising because it has nothing whatsoever to do with food, supplements, or other drug interactions. It is about something much more fundamental, much simpler, yet equally important: the timing of your daily routine. Diuretics, which are commonly known as water pills, are among the most frequently used medications for blood pressure control and fluid management. Drugs like hydrochlorothiazide, furosemide, and chlorthalidone are highly effective because they work by helping your kidneys flush out excess fluid and sodium from your body. This process effectively reduces your overall blood volume, which in turn leads to a lowering of your blood pressure. The timing problem associated with diuretics is remarkably common and widespread. Many patients, for a variety of reasons, end up taking their diuretic in the late afternoon or even in the evening. Sometimes this happens simply because they forgot their morning dose and are trying to catch up. Other times it happens because they were never provided with clear, explicit timing instructions from the outset. However, the predictable and often troublesome consequence of taking a diuretic too late in the day is simple. It leads to frequent, disruptive nighttime urination, a condition known as nocturia. Most people, unfortunately, accept this as a normal, unavoidable part of aging or their treatment. But I am here to tell you that it is not normal. It is a preventable side effect that is directly and almost entirely caused by incorrect timing. Here is what I desperately want you to understand about why this matters so much, and it goes far beyond just the misery of a disrupted night's sleep. Every single time an older adult, or anyone for that matter, gets out of bed in the middle of the night in the pitch black, often still feeling groggy, disoriented, and with blood pressure that can shift suddenly and dangerously upon standing, the risk of a fall increases exponentially. These nighttime falls in the elderly population are a leading cause of devastating hip fractures. And here is the stark, sobering reality that many people are completely unaware of. Hip fractures in patients over the age of 70 carry a frighteningly high one-year mortality rate of approximately 20% to 30%. That is the potentially life-altering real-world consequence of something as seemingly simple as taking your diuretic at 6 o'clock in the evening instead of 8 o'clock in the morning. The clinical rule I give to every single one of my patients on a diuretic is this: Take it in the morning, ideally before 10 a.m. This ensures that the peak effect of the medication occurs during the daytime hours, when you are awake, active, and ambulatory, not in the middle of the night when you are most vulnerable. If you are prescribed a twice-daily diuretic, the second dose should absolutely never be taken later than 2 p.m. under any circumstances, in order to minimize the risk of nighttime disruptions. Let's now move our focus to another extremely common and widely prescribed class of blood pressure medications, beta blockers. This category includes well-known drugs such as metoprolol, atenolol, carvedilol, and propranolol, which are prescribed not only for blood pressure control, but also for various heart conditions, including angina and heart failure. The vast majority of patients take these medications first thing in the morning. At the same time, a huge number of those same patients also drink their morning coffee, either simultaneously or shortly after swallowing their pill. Here is the critical physiological interaction that occurs inside your body when this combination is consumed too closely together. Caffeine is a powerful central nervous system stimulant. It activates your sympathetic nervous system, which is your fight-or-flight response, effectively increasing your heart rate and temporarily raising your blood pressure. Beta blockers, on the other hand, do precisely the opposite. They work by blocking that exact sympathetic activation, slowing your heart rate down and reducing the force of your heart's contractions. So, when you take a beta blocker at the exact same time as a significant dose of caffeine, it is almost like simultaneously pressing the gas pedal and the brake pedal on a car at the same time. In the vast majority of people, the medication's effect dominates and wins out. But in patients who have certain types of cardiac arrhythmias or underlying heart conditions, this combined stimulus can lead to uncomfortable palpitations or even dangerous irregular heartbeats during the peak caffeine window, which usually occurs roughly 30 to 60 minutes after consumption. Furthermore, there is emerging evidence that caffeine may directly influence how certain beta blockers are metabolized and processed by the liver, particularly metoprolol, especially in individuals who have specific genetic variations that affect the enzymes responsible for drug processing. My professional recommendation is simple and straightforward. If you are currently taking a beta blocker for blood pressure or any heart condition, I strongly advise you to try to wait at least 30 to 45 minutes between taking your medication and drinking your first cup of coffee. This is a relatively small and easy adjustment to make in your daily routine, but for patients who have a known history of arrhythmias or palpitations, it can be clinically and symptomatically meaningful. This is in fact one of the most frequent timing mistakes I observe in my clinical practice, and its impact can vary greatly depending on the exact medication involved and the unique physiology of the individual patient. Now, I want to address another very dangerous and widespread pattern that I see far too often in real clinical practice. A patient misses their morning dose of blood pressure medication for whatever reason. They forget, they were running late, or they simply got distracted. They remember later in the day, whether it is at noon, at 3 p.m., or even at dinner time. The human instinct is almost always the exact same response. Well, I'll just take 2 tonight to make up for the one I missed. This is a highly perilous assumption. For some specific medications with a wide therapeutic index, this might not cause major immediate harm. But for many others, especially the powerful calcium channel blockers, certain long-acting ARBs, and beta blockers, doubling the dose can precipitate a sudden, severe, and significant drop in your blood pressure. This dramatic reduction can cause debilitating dizziness, fainting, and, in older adults who often have reduced vascular stability and slower compensatory reflexes, it can even lead to dangerous falls and serious injuries. There is another variation of this same problem that is equally concerning and more insidious. I have encountered numerous patients who are prescribed twice-daily medications, but who have quietly decided on their own to switch to once-daily use because it is simply easier for them to remember. Often they make this change without ever informing their prescribing physician or pharmacist. Their blood pressure readings may still appear reasonably acceptable during their periodic checkups, so this unauthorized reduced dosing is never identified or corrected. However, the reality is that their overall cardiovascular protection is incomplete and inadequate. They are leaving themselves exposed to risk during the periods when the medication has worn off. The standard, universally accepted guidance for missed doses is as follows. If you miss a dose and it is still the same day, take it as soon as you remember. However, if it is already close to the time of your next scheduled dose, you should simply skip the missed one and continue on your regular prescribed schedule. Under absolutely no circumstances should you ever double up on your dose without first consulting your physician or pharmacist. The correct course of action depends entirely on the specific medication you are taking, its half-life, and your individual health status. Before we conclude this discussion, I want to make one thing absolutely and unequivocally clear. Blood pressure medication saves lives. The overwhelming body of evidence supporting the aggressive treatment of hypertension is among the strongest and most robust in all of cardiovascular medicine. I am not here to tell you to stop taking your medication. I am not here to suggest your doctor has made a mistake. What I am telling you is that the crucial conversation about timing, about when to take it, what to take it with, and what to do in the event you miss a dose, is often conspicuously missing from a typical short medical appointment. And this gap in understanding, this missing piece of the puzzle, can have genuine and serious real-world consequences. If you are over the age of 60 and currently taking blood pressure medication, or if someone you deeply care about is, here are 5 vitally important questions that you should actively ask at your very next medical appointment. First, should I be taking my specific medication in the morning or at bedtime for the best possible effect? Second, are there any specific foods, over-the-counter supplements, or drinks that I should actively avoid taking around the time of my dose? Third, what is the exact recommended protocol for what I should do if I happen to miss a dose? Fourth, is there a particular time of day when my individual blood pressure tends to be at its highest, and how does that factor into my timing? And fifth, are there any potential timing interactions I should be aware of between this medication and my other prescription drugs? These 5 straightforward questions, asked clearly and assertively, can do more for your overall cardiovascular safety and peace of mind than almost anything you could hear in a video. Why? Because your physician has access to your complete, comprehensive medical history, and your pharmacist has access to your full medication profile, which I do not have. But what I can give you is the power of the questions that can open that vital, potentially life-saving conversation. If this information has been helpful to you, if it has shed light on something you did not clearly hear or fully understand during your last appointment, please take a moment to share this video with someone you care about who is managing their blood pressure. And please, consider subscribing to this channel, because every single week, I will continue to share the kind of deep, clinical insights that patients often never hear until it is, unfortunately, too late. I'm Dr. Mandell, and I will see you in the next video.